So Afib is not usually life-threatening, but it can be serious. When someone has atrial fibrillation, what it means is that one chamber in their heart is not pumping like it would normally pump. So it's just kind of quivering. And when that happens, blood clots are more likely to form. And so that can be a big risk factor for stroke. So anyone who has atrial fibrillation, you really do need to be seen by a physician to see if you need to be treated. Sometimes there are medications that can actually treat atrial fib, but sometimes patients will actually need to be on anticoagulation just so that their blood does not clot and have that high risk for stroke. Afib is classified several ways. First way is paroxysmal. And what that means is someone has an episode of Afib that resolves within 7 days. That could either be it resolves on its own, or there may be medication or treatment that helps that to resolve. Persistent would be atrial fib that lasts longer than 7 days. They may still treat that and try to get the patient out of atrial fib. And then long-term persistence would be more than 12 months of a person being in atrial fibrillation. The fourth classification would be permanent, and that would be when someone they are persistently in atrial fib and the physician and the patient have decided that that's just the way they are going to be for the rest of their life. So that would be permanent. Stress can be associated with Afib. It won't necessarily cause someone to go into Afib, but it is definitely good for your heart, for any heart disease, to lower your stress level. So things that can help with that are meditation, relaxation exercises, and then just exercise in general can help to relieve stress. So lowering your stress level would be important to helping with Afib, as it would for any heart disease. So a patient that is in Afib, some of the things that might help with that are really the things that would help with any patient that might have heart disease. So having a good diet is very important, and especially with Afib, limiting caffeine or maybe taking it out completely can help, because sometimes caffeine can trigger Afib. Exercise is important. If a person smokes, they should stop smoking. And those are probably the big things. Also controlling blood pressure. That's also very important. Usually if you have high blood pressure, you're probably going to need to be on medication. So the best thing to do to control high blood pressure would be to take your medication regularly, not miss doses. Have your blood pressure checked frequently to make sure that you are controlling it. If you have a good diet, if you exercise, you don't smoke, those also help with your blood pressure.